Shifting focus to debate 2. There is a political face-off over the Pfizer vaccine, which has come under fire across the globe. Pfizer CEO was confronted in Davos, accused of rolling out an expensive yet ineffective vaccine at the beginning of the pandemic. Details have emerged in the past few weeks that there was data integrity issues in connection to the vaccine trials. The company has been accused of reporting adverse events in phase 3 trials late and has even admitted to having misled the European Union Parliament over transmission prevention. While India was developing its own vaccines, Pfizer demanded an indemnity clause to roll it out in India, meaning it sought a liability waiver for an adverse impact. Now, after the Davos video went viral, Union Minister Rajiv Chandrasekhar took to Twitter to slam the Congress, accusing it of lobbying for the Pfizer vaccine's rollout in India. He says that while the pharma giant tried to bully the government, the trio of Rahul Gandhi, P. Chidambaram and Jairam Ramesh kept pushing for the Pfizer vaccine. Now, Chandrasekhar has claimed vindication as the government denied granting the indemnity clause to Pfizer. Meanwhile, Jairam Ramesh hit back at the union minister, accusing him of spreading lies. Now, let's remember, vaccine information was in a constant state of flux at the beginning of the pandemic. Pfizer's vaccine was approved by the WHO and was one of the first vaccines in the market. The government maintained its focus on indigenous vaccines, which have proven to be more effective. I got that. And most Indians have been given either Covishield or they have taken Covaxin. While the Congress did question the vaccine police every step of the way. So has the government's stand been vindicated? Is the Congress guilty of playing politics, or did it simply raise questions?
We now know that the vaccines didn't stop transmission, but why did you keep it secret?
Have a nice day.
Shame on you, sir.
Shame on you.
Joining me now, Rajiv Pandey, BJP spokesperson, Mahima Singh, spokesperson of the Congress Party, and Dr. Rajib Dasgupta is JNU professor and member of National COVID Task Force. Mahima Singh, will all those who were speaking in favor of Pfizer, saying that Indians are being deprived, should they not compliment the government of not succumbing to the pressure of this company today?
Good evening, Maria. Good evening, all. Well, nobody was accusing the government of not, or nobody was speaking in favor of Pfizer, I would say. Our leaders were rather saying that when there are options available, and the findings have come only now, they were saying that if there are options available, we are all for foreign trade. And it would have been befitting for the consumer to decide on which vaccine do they want to go for. And right now we are talking about a government. I think this whole debate is not about whether the Congress leaders were right in talking about bringing in more options of vaccines or not. This whole debate is about, how the government has been running away from its accountability. In fact, you have talked about a couple of things in the beginning. You were talking about indemnity. Let me say that we have a government here which wants to indemnify itself from its own subjects. Before the Supreme Court, it files an affidavit where it says, we are not responsible. You ask them who's responsible for the deaths due to oxygen shortage. They say there are no deaths and we are not responsible.
But we are talking about Pfizer right now, ma'am.
No data.
We are talking about how the government says that Pfizer, which obtained indemnity in many countries, including US and UK, the government of the day said that they have to be held accountable if there is a side effect or death. And that is the reason why Pfizer did not come to the Indian market. So the question is, so if the government at that time had decided to follow a proper protocol, they realized the ramifications of their decision. It was about life. It was
See,
about
one
dealing
thing-
with lives
one
of
thing, Maria,
Indians. Shouldn't,
one
in the hindsight, let's look at it from the hindsight, ma'am. I'm not questioning why did the opposition question then. It was all within the rights, let the opposition question. But it's about looking at the events in hindsight. If you're looking at it in hindsight, would you not say that government was right, that they did not sign this
my
indemnity
God.
clause?
In fact, if you look at it in the hindsight, is exactly when I would not say that the government was right, because if you look at it today, the findings are all upfront. And today, maybe the other parties would have also maintained, or in fact, any conscious person would have maintained that okay, this company is not taking its accountability, so let's not bring it. But in hindsight, these findings were nowhere to be seen. Pfizer
Fine
has
enough.
been
Okay, let's look at it from the point of view now. Rajiv Pandey, at that time, the Congress also, like anybody, did not have data on Pfizer. The company had also not put out the trial 3 data. So then why should this be seen as they questioning you wrongly?
Maria, there are 2 points on this question. One is that a foreign company, we know how these pharmaceutical companies across the globe are pressurizing and they are trying to book the profit. That company was pressurizing Indian government that you have to give liability waiver, which was rejected. At that time, Congress party in general and particularly these 3 leaders were saying, some organizations are saying that in India there will be death, 50 lakhs death will take place. This will happen, that will happen. At that time, government was working how to produce own vaccine.
Yes.
And trials were going on. You understand, Maria? Just give me some time. This is a very serious subject. So at that time, government took a decision under the leadership of Modi ji that we have to produce our own vaccine. And we did this with another company from UK. And that production started in India. And at that time, WHO was also playing in the hands of these pharma giants. They give certificate to this Pfizer, but they did not give a certificate, our product. But government took this decision that we will get vaccinated every Indian. So that is one aspect. Second aspect, they were saying, there will be vaccine shortage, so you should import. Congress is a habitual offender on that count, that at several times, whether Russian deal, Bofor's deal, this deal, that deal, I cannot say because I do not have any information that why these 3 leaders were after the government that you do this and allow this.
Okay,
Second
why
point,
were they backing
Hold on,
this
one
pharma
second.
company is the question that is being asked. But before that, because we have to put
Yeah,
this
I
in
have one more
context
point,
by National
Maria.
COVID Task Force member also, Dr. Gupta. Dr. Das Gupta, the question being
Can I
raised
just
here,
add one
and it's
line?
all
Maria,
emerging
can I
from
just
the
add one
point of
more
view
line?
that there were reporters who ambushed the Pfizer CEO asking very uncomfortable questions, asking questions that they should be held accountable. But the larger question is also about the WHO, the World Health Organization. It is about them being held criminally liable as well. Just look at what they did. Without this company providing all the data, this is the company which gets the certificate from WHO, but Indian vaccine is, and there are several multiple levels of checks that Indian vaccines had to undergo, and we have seen the result. How India managed its entire vaccine story.
Thank you. If I got your question correctly, there are several parts to it. I'll try my best to respond as clearly as possible. First, essentially, I'll leave aside the political framing to the politicians. Essentially, what we are trying to understand is how did this vaccine governance work both globally as well as from India's point of view. Now, what essentially the US did was to set up what's known as the Operation Warp Speed, which is essentially a public-private partnership or arrangement where the US government was investing in the private companies to develop vaccines, which is also what India did, mind you, through the Department of Biotechnology. So essentially, we also followed the same model. Now, the pandemic the governance model of a pandemic implicitly demands that there's a global equity to vaccines that are developed first, and that there is a sort of a polar position of economically advanced countries being able to produce vaccines and the low-income countries demanding that they get access to those vaccines in as equitable a manner as possible. And that's where international governance mechanisms through the even agencies such as the WHO, which is a technical agency, comes into play. And that role has, as you sought to point out, did come under criticism. And now, therefore, there's a talk of pandemic treaty, which can take in more equitable distribution, etc. What India essentially, the path that India essentially followed was primarily one of what's known as vaccine sovereignty, which is develop your vaccine and making this available for the bulk of your population.
Yes.
And with a bit of vaccine diplomacy, which, as we know, through Vaccine Maitri, etc., was contribution to neighbors and other countries.
Okay, so that's very well put. The focus was on vaccine sovereignty. But Mahima, please make your point, and then I bring in Rajiv Pandey.
I wish to say, there are 2 points here, Maria. One is a question that did any indigenous vaccine manufacturer also, declare that they can prevent transmission? No, they did not, and they still cannot because it is not possible. Other thing is, there is this government, there's this body called NTAGI, NTAGI, National Technical Advisory Group of Immunization, which has, a former member by the name of Jacob Puliel. And he has asserted that the government lied before the Supreme Court as far as AEFIs were concerned, adverse events following immunization were concerned. And he has also asserted that Corbevax, which was used for the younger age group, was not even given a go-ahead by NTAGI, which is supposed to give a go-ahead. Things like that. And on top of it, we talk about you're saying that you do not politicize it, you do not look at other aspects of it. But I'll have to say what the government did, what the Congress said, it has to be looked, at in relation to each other. Because what the government
the question here is that here is Pfizer, which is now accepting that they did not know if their vaccine prevented transmission, that they did not have data in vaccines' effectiveness in reducing transmission. So now Pfizer has accepted this. Will the opposition accept that they jumped the gun? That much before, no ma'am. The question here is,
the union minister, the union minister, what he's doing, he's playing a blame game. What he's doing today, he's, trying to put the gun on the shoulders of this international dialogue that's going on. And he's trying to target the Congress in lieu of that. Number one, what we are seeing on the international front is, something very unusual in India these days. That's freedom of press. In India, you cannot go asking questions.
Let me give the final words to Rajiv Pandey. Rajiv Pandey, now this is taking the turn of freedom of press also now. So, the question is, let's look at it from this point of view also, Rajiv Pandey. The opposition was doing its part in questioning every move of the government. Isn't that what they are supposed to do?
Mariaji, opposition can certainly question every move of the government, but it will be better if they question the wrong move of the government, not the right move of the government. You can question. But what I'm saying,
no, but if Pfizer was the first vaccine in the market, then the opposition, how are they wrong in saying that let the Pfizer come in Indian market?
I'll tell you the reason. They should have gone and talked to the government and talked to the person who were in charge, because we were about to complete everything and 2 vaccines were about to be to come to India for the people. What I'm saying, they are saying, nobody said what is the effectiveness. Government selected these 2 vaccines for the people, and more than 220 crore doses.
There is no transparency.
Doses is already. Mahimaji, please allow me to complete. I did not.
Go ahead.
What I'm saying, opposition parties even asking, take that Chinese vaccine. They were trying to on 2 fronts. Because they were trying to discredit the government. So they were saying these vaccines are useless. You can remember Akhilesh Yadav's statement. And later on, he went and took from a private person that give me vaccine. Modi ji ka
No, but
vaccine
the
ले लिया
question
उन्होंने।
is that without even understanding whether a particular vaccine is effective or not, why did various parties and various politicians say procure
That's
that
the
vaccine?
question.
That is
Maria,
the
that is
question.
the
And
question.
also,
Yeah.
here is the company which was bullying India into saying sign
they were
the
supporting that
indemnity
company.
because they did not
they
want
are
to be
supporting
held
that
accountable and
company.
liable for what
Yeah.
has happened. India was
Maria,
right
I
in
have-
choosing not to do that.
Yeah.
Because it
I have
was a
a
slippery slope. We have seen what it has happened in other
Now-
countries. Thank you so much for your
Maria
time.
ji, only-
Rajiv
only,
Pandey,
you know,
Mahima Singh, Dr. Rajiv